Hello everyone, today I'm going to show and take you through one of our new MSK specific templates. If you go to the bottom left corner of System 1 and search MSK Presentation, you'll see the MSK Presentations -back pain full stop template. If you pull up that template, you'll see that it looks quite different to some of the classic Ardens templates available. It has 6 tabs. That's the Consultation, Examination, Notes, Causes, Referral and Resources tabs available. Today I'm going to take you through the template start to finish, describe some of the usable functions and hopefully help you all to navigate this template slightly better when you come to using it in clinical practice. At the top of the screen there's an encounter drop down box and you can record what type of physiotherapy appointment this was. There's drop down boxes for the severity of the patient's condition and whether or not the condition is improving, resolving, stable or even worse. There's 3 text boxes for the duration of symptoms, associated symptoms, aggravating factors and relieving factors. You can input information manually or alternatively you can click this preset information box and insert data to save you time during your consultation. There's a vitals section where you can record temperature, blood pressure, heart rate, pulse and respiratory rate. And an exciting new development is our increasingly specific red flag information. You can see here the first red flag tick box refers to Cauda-Equina syndrome. If you were to suspect a patient of having Cauda-Equina syndrome and hit yes to this red flag box, there's a direct link to one of our new possible templates to the right hand side. If we bring up the possible Cauda-Equina syndrome template, you can see that there is increasingly specific questions that you may wish to ask the patient in order to delve a little bit deeper into their presentation. Once you've asked these increasingly specific questions, you help to build a clinical picture of whether or not the patient is unlikely to have Cauda-Equina syndrome, or if Cauda-Equina syndrome is in fact possible. If you suspect or have a higher index of suspicion that Cauda-Equina syndrome is present, you can hit the impression box below, which will pull up an explicit and very accurate management plan for you to follow. If we exit this and go back to the back pain template, you can see the impression section here. There's a drop down box where you can input a specific diagnosis and a free text box where you can write any suspected pathologies that might be present. Now you can input this manually or again you can choose from our pre-selected boxes here. Moving on to our management section, there are tick boxes that can record whether or not you've given a diagnosis, set any realistic expectations, or given any self-help advice, and there's appropriate safety netting tick boxes in case the patient's symptoms worsen, change, or don't improve. There's drop-down boxes to record any analgesia that might have been administered or prescribed, any referral to onward imaging, if there's been a fitness for work statement that's been issued, or a care plan that may well have been produced. There's links to the resources section, links to the Cauda-Equina safety net care plan, the analgesia formulary, MSK imaging criteria, the fitness for work statement, and low back pain and chronic low back pain care plans. In the examination tab, you can use the drop-down menu and the drop-down text boxes to record physical tests and physical findings. On the right hand side here you'll see a dermatomal map which you can use to input any sensory abnormalities that you may have found during your clinical examination. Onto the notes section, there's 3 text boxes where you can input further information about the assessment, management plan, any yellow flags that might well have come up, and any ideas, concerns and expectations that the patient may have expressed during the consultation. On the causes section, you can adequately rule out any red flag information, exclude any common pathologies and document what might well be probable or possible from your clinical examination. In the referral tab, there's a split between urgent and routine referrals with specific criteria that might well help guide your onward management of the patient. Finally, in the resources section, you can see here web links that link directly to further resources, signposting information, education, and even exercises which your patient might well find useful. Lastly, I'll draw your attention to the help and feedback button that's present on all of our Ardens templates. Please do get in contact with us with any queries, concerns, or any feedback. Also, keep an eye out for our new MSK presentation and symptom-specific templates, which we will be releasing very, very soon. Thank you very much for listening. Goodbye.